Well, first, the Western Cape is bracing for its third wave, and it seems it is prepared. But Gauteng is definitely buckling under the pressure. Medical experts are saying Gauteng authorities have not taken lessons from the previous waves. The most populous province is now responsible for over 60% of cases in the country, with many of the hospitals at capacity. Ayesha Ismail reports.
Unfortunately, I think we've just been too slow to manage or to contain the spread in Gauteng. We're dealing with exponential growth, and when you start to see exponential rise in the number of cases, you need to respond immediately.
With the rise in cases and Gauteng having surpassed the previous two peaks and rising, experts are laying the blame fairly and squarely at the door of the Gauteng Health Department.
Hospitals are already overwhelmed in Gauteng. I don't think we're placing enough focus on that. I don't think we're improving the hospital capacity as much as we should. And we do know that one of the big hospitals, Charlotte Macquarie, is out of action now. So that puts a number of beds that previously were used for COVID-19 out of action too. So the healthcare system is really under strain in Gauteng.
He says more staff must be hired right now to deal with hospital admissions to save as many lives as possible. But Western Cape officials say they are prepared and ready for the third wave.
We have a 6-point plan, and obviously the critical aspect of that 6-point plan is the health platform response, which in our case is a comprehensive response. And it really starts probably with surveillance and outbreak at a community level. We have very strong teams on the ground to identify cluster outbreaks immediately, try and contain it as much as possible, but also obviously do the contact tracing.
He says the Western Cape has a strong primary healthcare response, which avoids people coming into hospitals when they don't need to. This frees up space for the very ill. Karim says they took lessons from the previous waves, adding that there are enough beds and spaces in hospitals to deal with the third wave and the peak.
We had also added more than 600, but in fact 626 additional field hospital beds. Those beds are still available, and we have the capacity to staff those beds. They are fully equipped, and we can manage our patients there as well.
But Karim stresses staffing is paramount.
One must make sure that there's sufficient staffing. We had put a number of people, added a number of healthcare workers, particularly nurses, on contract. We've kept them on contract. We still have them on contract, and they're available for the third wave. And in fact, we're using them as vaccinators as well.
He says they've kept 2 of their field hospitals open after the second wave, and they are still fully functional with staff and all. The province also entered into a contractual relationship with large private hospitals even before the first wave hit.
During the second wave, we actually found that the private hospitals were so busy that they in fact required us to assist them, and we were able to utilize some of the contractual agreements that we put into place. And I think it's really critical that the public and private sectors have to work together.
Karim says the Western Cape's vaccine rollout program is going so well, it has exceeded its weekly targets.
So because we've exceeded our weekly targets for the last 3 weeks, in fact, it strengthened our hand in making a case to the National Department to allow us to be given extra doses of the vaccine. And so for the following week, the week after next, we'll be receiving 121,000 doses of the Pfizer vaccine. So we're quite pleased about that. We have the capacity to administer those doses.
Karim says strict measures have ensured clean audit reports for purchasing PPE. Ayesha Ismail, Cape Town.